epidemic of errors in our nation's hospitals. A patient getting the wrong medicine, a doctor missing a tool during surgery, even removing the wrong limb. A new study finds that such medical mistakes are more common than you know, and they could be the third leading cause of death in this country. Shocking report. Jonathan Serrie takes a look at what's going on out there, what's being done to stop this or change it. He's live in Atlanta. So is this a new problem? Has it gotten worse, or are we just learning more about it now, Jonathan?
Good morning, Martha. Well, the study's authors say that the problem has been underreported. The issue is that when someone dies, the cause of death is listed on a death certificate. Well, the causes of death fall into an international code, and hospital error or medical error in general is not among the potential codes that you can use on that death certificate. And so the problem is often not reported. Researchers at Johns Hopkins University analyzed individual studies on medical errors to come up with a nationwide estimate. That estimate, more than 250,000 deaths in a given year. If accurate, that would place medical error as the third leading cause of death in the U.S., just after heart disease and cancer, and more lethal than lung disease or car crashes. They've published their analysis in the BMJ. Martha?
So what do they think the solution is?
Well, these Johns Hopkins researchers say that first, death certificates should allow you to list the cause of death, even if it doesn't fit into one of those nice, neat international codes that are customarily used. They also suggest that certificates could include an extra box asking whether a preventable complication from medical care contributed to the patient's death. They recommend that hospitals conduct independent investigations into deaths for potential errors, and they say a standardized method of reporting and collecting this information is needed to get an accurate national picture of the problem so that medical providers can learn from their mistakes and hopefully do no harm. Martha?
Yeah, there needs to be accountability as well for mistakes. Jonathan, thank you very much.